rugged changes to the bone.
Right.
That's what we want, so that's good.
Good.
There's a little bit of spondylosis bridging right here and right here, and that kind of just comes with age. But
Nice one.
yes,
Yours. Right.
his chest looks nice and clear. His heart, I mean, everything else looks fine up here.
Awesome.
That's his microchip.
Aw.
And then he didn't like laying on his back, so it was hard to get a straight shot, like
Aw.
positionally wise.
Right.
But let me see if I can.
Good boy, Luggy.
So what I'm looking at is if there's any kind of change, and this is a good setting where you can change I'm looking in between the vertebrae. Everything looks pretty normal in this view.
Thank you.
Then when we go, he's got
That's his
nice,
stool?
this is all poop right here.
Oh,
See how
wow.
that's like white? But this is just gas in his belly because
Yeah,
he's
he's
been
got
pantsing
so much gas still.
Yeah.
He's had gas all year since everything's been going on.
He's like,
I give him Pepsid.
That's
what else
good.
can I give him? Yeah.
you can do Pepsid.
How many can I
You
give
can
a
even do
day?
Gas X, like
Really?
regular Gas X. Yeah.
Really?
Yeah, and he's a big boy, so you could give him 20 milligrams twice a day.
Okay.
The Gas X, the same thing that you and I take, like if it's like 125 or 185 of the simethicone, you can do that 2 or 3 times a day too.
Okay.
His
And
vertebrae,
What about Prilosec? I'm sorry, because I know doctor put him on Prilosec.
you can do
after
Prilosec too. Yeah,
He ate the bag.
yeah, you can Prilosec, omeprazole. There's a lot of good stuff for that. But as far as like the gas, you're probably better off doing Gas X.
Okay.
All of these vertebrae are nice and clean. There's no bridging. Everything is nice and smooth. This is him on his back with his belly. And again, we're just looking at anything that's abnormal. Now, this is a lot of gas. So once he passes that bowel movement, he might be even more gassy because that's probably waiting to go to come on out.
Yeah.
Pictures of his, again, his shoulders, nice and clean. Even his elbows,
They're not that
there's just,
bad?
pretty minimal changes. So there's some minor changes right up here, but it's not even at the joint space. What I'm looking for, because this is where all the movement takes place, that's nice and clean.
Good. Thank you.
So now the problem spot.
Aw, look at his legs.
Do you see how
Yeah.
rough and rugged
Yeah.
on
it's not
each side?
clean.
What the femur should look like is it should come to a skinny neck and then a smooth ball.
Aw.
And this side is almost even worse. It's hard to say. This is his left side. So
Yeah.
this femoral neck should be here, but it's all the way out here. So
Wow.
he has bony remodeling.
Yeah.
And do you see how there's some
Like a gap.
see how it's kind of bumpy on the edges? The ball and cup, the cup is trying to help keep the socket in place, so it's causing these bony bridging, and his hips are the problem for sure.
Aw.
So getting him on the glucosamine can help. Dr. Phillips isn't here today for us to ask about sending with the injectable medications, but we can at least give you a few of the Coxiba until he gets back in town.
Sounds good.
And then-
And I totally understand.
Yeah.
They've done more than enough for me for the last 30 some odd years I've been coming here.
But I would say he's definitely a candidate for the Adequan because that's going to help with the cartilage. And on, the Librela is good for pain control, but if he improved with Coxiba alone, maybe